Welcome to Earth911, Sustainability in Your Ear. Today we're going to discuss some of the health consequences of continuing carbon emissions, business as usual, and the health impacts from the pollution it produces. Out on the West Coast, we're getting used to a new season, smoke season, when it is often dangerous to breathe the air. According to a new study published in the journal The Lancet Planetary Health, air pollution was directly responsible for the death of 4.5 million people around the world in 2019. A McGill University study released in early May reported that people who lived within 31 miles, that's 50 kilometers if you're wondering why it's a strange number, from a wildfire over a 10-year period were found to have a 10% higher incidence of brain tumors and 4.9% more lung cancers. Smoke season isn't just unpleasant, it's killing many of us too. We're joined today by Dr. James Crooks, Ph.D., an environmental epidemiologist with National Jewish Health's Division of Biostatistics and Bioinformatics in Denver. He studied the impact of wildfires on the ozone level at ground level in Colorado, which contributes to a rising incidence of asthma and diabetes, amongst other conditions. Dr. Crooks found that while ozone increased only 1%, the impacts were widely felt, especially in Hispanic and historically underserved communities. The advent of annual smoke seasons and the rising levels of air pollution globally make this an important conversation. And you can learn more about Dr. Crooks and National Jewish Health at nationaljewish.org. National Jewish is all one word, no dash, no space. Welcome to the show, Jim. How are you today?
I'm great. Thanks for having me, Mitch.
Well, thank you for joining us. It's great to have folks come on and talk about these important issues. Can you begin by outlining the impact of what more wildfire smoke and air pollution is doing to our health overall?
So I think most people understand pretty intuitively that when they breathe air pollution, it affects their lungs because, their chest feels tight or their child starts coughing. And we do see that in the data as well. Like we see that when air pollution is higher, we find that people who have chronic lung diseases are at higher risk of exacerbation, like an asthma attack or a COPD exacerbation that can be really severe. It can make people even have to go to the hospital. And if they're really medically fragile, actually send them into a spiral where they end up dying. And so I think that's pretty intuitive. Most people get that is a connection that exists. But what I think people really don't understand is that is just the tip of a much, much larger iceberg of health effects. And it turns out that there's basically no organ in your body that isn't affected by air pollution. And you might be wondering, why is that? How can something you breathe affect your kidney or your heart or something? And it turns out that the mechanism involves inflammation. So just like when you get a cut on your skin, your skin turns all puffy and red. That's your body's inflammatory response. Your lungs kind of do the same thing. And when your lungs are attacked by air pollution, your lungs try to defend themselves through inflammation. But that inflammation doesn't stay in your lung. It actually can spread throughout your bloodstream to every other organ system in your body. And in fact, the strongest link we know of between air pollution and your health is particle air pollution and your heart. So we find out when those inflammatory cells or those inflammatory chemicals get into your bloodstream, they can actually increase the hardening of your artery walls. They can increase the growth of plaques in your arteries. And, we find that people who have heart disease are at increased risk of those plaques actually rupturing and causing a heart attack or a stroke or a blood clot. So really, the health effects of air pollution are much bigger, much broader than most people realize.
Now, in your research and in other research, the term climate penalty is really starting to emerge as an important concept. Can you explain that and whether or not we should think of climate penalties as having a linear relationship to the increase in pollution?
Yeah, so when the research of mine that you were discussing, we were looking at specifically the ozone climate penalty, which is because ozone is an air pollutant that's really sensitive to temperature and weather. We know we expect that we have more of it now than we would have had if climate change hadn't happened, or we expected there to be more in the future than there would if climate change weren't going to happen in the future. So when we're talking about climate penalties, we're usually talking about what is actually experienced today versus what we would have had without climate change, or maybe projecting that into the future. So you can look at that in terms of ozone, but you can also look at that in terms of kind of other air exposures, things like wildfire smoke. You can, study the wildfire smoke climate penalty, even things like pollen, because we expect, pollen to increase because through warmer temperatures and higher CO2 levels. And you can kind of broaden that concept to other things too. You could even potentially talk about like the agriculture climate penalty, how food supplies would decrease with climate change, that kind of thing.
So it's clear then that all these irritants that we're emitting into the environment are contributing to our health declining, because we're part of a system that's falling apart and our body systems are responding.
Right. Yeah. So air pollution, a lot of its impacts we don't really see because they tend to be kind of slow and subtle and not easily distinguishable within a specific person from the process of normal aging. But when we look at large enough populations of people, we can understand that, like, okay, well, maybe this person would have gotten, a heart disease diagnosis at 40, but they lived in a polluted place their whole lives. So maybe now they're getting it at 36.
Right.
Maybe they would have had a stroke at, 55. Maybe they're, but now they're actually getting it at 52.
Now, your research found that underserved communities along the Colorado Front Range suffer more from these increased ozone levels. A lot of people aren't clear about the relationship between environmental inequity and these direct impacts that we're seeing. How does that work? Why is that hitting those communities harder?
Well, yeah, so we found that the additional ozone that we're getting because of the climate change we've already experienced tends to be higher in those neighborhoods in the Denver Front Range area that also have higher percentage of people who are identifying as Hispanic or Latino, people who don't have health insurance, people with kind of poor health. And the reasons for that is we didn't get into the reasons in our paper, but I think the obvious reason is where people live. And that is a combination of, some amount of personal choice, but also a whole lot of like socioeconomic factors and, a century and a half of discriminatory housing policies that sort of force lower income people of color to live in communities that tend to have more pollution.
Now, there are also reports that brain cancers are increasing, by up to 10% if you're within 31 miles of a wildfire. And incidentally, my brother, who lived through 3 major wildfires in Santa Rosa, California, died of an extraordinarily rare brain cancer. So it had never really occurred to me that they were linked. Do we have any sense of the mechanism that connects particularly wildfire smoke to increased incidences of cancer?
So we know that, systemic inflammation, which is, when you're constantly exposed to air pollution at a even relatively low level, your body is kind of constantly inflamed a little bit, which can sort of interact with, your cellular processes that involve sort of your cell splitting, which is where cancers come from. It's like mistakes in your cell splitting. So it is sensible and has been long established that air pollution can increase risk of lung cancer over time.
That's the obvious one. How does it get into the brain? Do we know?
Other kinds of cancers, it certainly wouldn't be a surprise. So, we actually have evidence of diesel nanoparticles in the brains of human subjects, like cadavers. When people dissect human cadavers, they actually find things that are chemically obviously diesel nanoparticles in their brains that are surrounded by little nodules of immune cells. And so if your brain, if you're having a really strong immune reaction in your brain, it's probably damaging other cells there too, which could cause, a mutation that results in a tumor. So the mechanism is, I'm sort of hypothesizing the mechanism, but it's, it's not super surprising that other kinds of cancers would be related to air pollution too.
Now, one of the things that the whole country is experiencing is these smoke days are even reaching the East Coast from the fires in the West. How close to a fire do you need to be in order to really experience a direct health effect? Or is this literally a problem that's spreading around the planet?
It's pretty much everywhere. Certainly if you're like next to a fire, your exposure is going to be very high. But, clearly we have places in the country that are not experiencing wildfires, but where they're getting smoke from, 1,000 miles away. I mean, I think last summer we had, high smoke levels in the upper, the East Coast from fires in Minnesota and Canada. And we here in Denver routinely get smoke from California and Idaho and Washington State. So, I mean, smoke can travel a very long way. And it turns out that at least even if the concentration you're breathing is lower, there is some evidence now that the toxicity of the particles in that smoke actually gets worse the longer it's in the air. So even if you're not exposed to as many like grams of smoke, in Denver as you would have been in California, on a gram for gram basis, that smoke may actually be more dangerous.
That's surprising and very concerning to hear. I'd always assumed that, for instance, heavy metals and other heavier elements would fall out, and therefore the further the smoke was from the fire, it would be less toxic. But wow, okay, that's not good news.
So the oxidation state of the smoke seems to increase the longer it's in the air, which can have greater toxicity when it's breathed in.
I want to stop and take a moment to think about that, and we're going to take a commercial break. We'll be right back. We're back to talk with Dr. James Crook about the impact of wildfire, smoke, and air pollution on our health. So I'm still really trying to come to terms with the idea that the further away you get, the more difficult this is for the body to process. How does the combination of extreme heat and wildfire smoke impact these emerging health risks?
Well, that's a great question. That is an area that I think needs some more research. We need a lot more research on the health effects of these combined exposures, because there hasn't been a lot of that. Normally we look at one exposure at a time, but you can imagine like somebody with heart disease, they're probably going to be at increased risk of a heart attack and stroke from smoke exposure, but they may also be on beta blockers to control their blood pressure, and that's going to put them at increased risk of heat stroke. So if they're exposed to both smoke and heat at the same time, they're going to get this double whammy where they're like, the drug that they're taking, to prevent one thing is actually going to make them more sensitive to the other. And the more exposures we have, the more sort of situations like that doctors are going to start seeing, where there aren't good options for treating both these issues at the same time. And that means that the risks to somebody's, losing their life from, multiple exposures is kind of more than just additive, right? It's more than just, the individual exposures added together. Like it's those risks multiply together, not add.
So this is again another surprising and very concerning fact. It suggests that therapeutics that we are already using are going to be less effective in the new environment. So we really actually are going to have to recalibrate our entire health system in order to respond to this.
Yeah, for sure. And if you're sort of worried about the impact of smoke on your health, definitely be talking to your doctor about it. And if your doctor, particularly if you live in the Western U.S., if your doctor can't answer your questions or doesn't seem to think it's a big deal, you might consider switching doctors, because this is part of their job description now that they live in, a climate changed world. They really should know how to help you.
So let's talk about how to prepare oneself and one's family to live with wildfire smoke seasons. We all know the N95 mask too well now. Are they going to need to be a daily feature of life in the smoke era?
This is sort of up to an individual's personal preference, but I would say probably for a lot of people, yes, I wear one in smoky season. I think it's important because the kind of cloth masks that we've been using to fight COVID are really not effective against smoke. You really need a tight fitting N95, and they really can decrease your exposure. They're not a panacea. You will get some exposure if you're outside and you're wearing one, but they are better than the other alternatives. So I think N95s are going to be with us for a long time, because smoke is going to be with us for a long time. The trends for smoke in the Western US are trending up, and they're going to keep trending up for probably the rest of my life.
I unfortunately, I actually have the New Mexico wildfire dashboard open on my desktop as we're talking. And since we started talking, they added 3 new fires.
Wow.
And
that's amazing.
And the Hermit's Peak fire has burned 489 square miles. And of course, a lot of that's coming your way. How should we think about going out during smoke season? Should we not exercise outside? Should we think more about hydration or other things in order to reduce the level of irritation within our body because we stay hydrated?
That is going to be very much a person-to-person kind of decision.
Sure.
Used to be that pollution was, like maybe just bad in the afternoon, and you could switch your activities to the morning to protect yourself. But with smoke, that usually doesn't work. So, what do you do if there's smoke for just 3 months, straight? Do you just sit inside for 3 months? Well, that's not good. People need exercise, kids need to be outside in nature. But at the same time, you don't want to increase your risk of having, a bad outcome. So I think that's going to be very much a matter of sort of individual medical need and taste. That said, there are things people can do to understand what their risks are better, such as, looking at the websites for your local public health office. That particularly if you live in a smoky area, they tend to have alerts for, when smoke is high. You can actually look at the monitoring going on around you. Sometimes local public health offices have their own monitoring. The states often do their own monitoring. There's a great website called fire.airnow.gov, which shows you all the monitoring around that is sort of fire specific. So at least you'll have some sense of like, okay, is today better than yesterday? Maybe I go outside today, even if it's not, the air isn't super clean.
And how can we help underserved communities respond to this? What can we do in terms of policy changes or other efforts? Do you have suggestions?
There are a lot of things we can do because we do so little now. I think start with do a lot better monitoring in those low-income neighborhoods, not just for things like smoke, but for the things that are causing climate change. The fossil fuel emissions, the things related to refining and drilling fossil fuels. We do very little monitoring of those kinds of pollutants, and we do almost none in those communities where it actually matters. So we need to do a lot more monitoring. And with that monitoring, that gives those communities a big stick to thwack their government with to, sort of try to force the government to, reduce emissions from the major sources around them. I think sort of enabling local communities to get informed themselves and enabling them to, make change at the local and state level is really, really key. Also, just helping with decarbonization could be really important because even if you can't control the air pollution outside your house, a lot of times you can control it better inside your house. So, if you can clean the air inside your house, then that means that, overall your exposure is better. So retrofitting homes, so that they are tighter and have, cleaner ventilation. Also just encouraging people not to sort of smoke inside and, use incense is really important too.
Or incense. Okay. I had never thought not to burn incense, but I'll take that into account, particularly during smoke season. Now, this obviously is a global issue. India is experiencing both extreme heat and fires right now. Is there a global conversation going on in the scientific community about the lessons that we're learning all over the place? And are we learning anything that can help there and vice versa?
Well, I think we actually have learned a lot on the air pollution side that is helping other countries. Like almost all of the fundamental research on health effects of air pollution was done by the United States and is being borrowed by other countries, which isn't to say they don't do their own research as well. Plenty of them do. But a lot of the fundamental research was originally done here. Plus, the State Department actually has programs that help countries where we have embassies reduce their own air pollution. So either we have a monitor at our embassy or we sort of help with technical assistance with the host government to do their own monitoring so they can understand what their own exposures are. I think all those are really useful, but there's certainly plenty we can also learn from things that are going on in other countries. So like the extreme heat waves in India that we're having now, or the really indescribably bad fires that Australia had a couple of years ago, both can give us a lot of information about, how do our social systems and healthcare systems respond? How resilient are they to these really extreme events?
What are your recommendations for Denver to prepare for a typical summer, say in a decade, based on continuing emissions as they currently are?
I think it's important that we make sure that people in low-income housing have the ability to go indoors and be safe. Either they have fairly tight air envelopes on their homes. They have access to air conditioning, which a lot of homes here don't have, or were not built for. They have clean indoor air, either because they have air filters or they have an HVAC system that has a filter on it. So I mean, helping them in that sense, I think, is really, really key. The extreme heat and the extreme air pollution are going to be a real problem, and they're not going to go away anytime soon. So we need to do better in terms of just people's housing. We also need to do better in terms of programs to make sure that really vulnerable people can have somewhere to escape to if their house isn't cool enough or clean enough. Like they have cooling centers or clean air centers they can go to.
So more investment in a public infrastructure for cooling and access to clean air.
Yeah, exactly.
Great. Well, look, Jim, that's great advice, and I want to thank you for explaining all this to me, because it's again kind of mind blowing. I've been working on this for a long time, but it always gets deeper, and that's the problem with climate change. Thanks very much for spending a few minutes with us.
I appreciate it. Thanks so much.
We've been speaking with Dr. James Crooks, Ph.D. He's an environmental epidemiologist at National Jewish Health's Division of Biostatistics and Bioinformatics in Denver. You know, folks, the simple explanations that many people who object to the idea of climate change and global warming want to rely on, or continue to rely on, based on what we understood about our planet 20, 30, 50, and 100 years ago, is part of the problem that we need to overcome in order to address the climate crisis appropriately. We have to get everybody to look at this as a widespread systemic problem with deeper and deeper impacts that we're just beginning to understand. So overcoming that resistance to complexity is key to the political solutions to climate change. Hopefully we can all share some more information. Maybe you can share this podcast with your friends and family and get them thinking about what we need to do in response to smoke season to protect our health, but also what we need to do to change carbon emissions in this society so that we don't kill this planet, or rather, we don't kill ourselves and the planet goes on without us. This is Earth911 Sustainability in Your Ear. Not always a font of happy and fun news, but I hope this is a useful conversation for you. We're going to be back soon with another innovator interview. In the meantime, I do hope you'll take a few minutes to share this podcast with everyone you know. Let's get more ideas out there so there's less waste and less pollution. We'll be back soon. In the meantime, folks, take care of yourself, take care of one another, and let's all take care of this beautiful planet of ours. Have a green day.